Welcome to my channel, Brainies. Today we are going to discuss about the topic reflexes, deep tendon reflexes. So what is a reflex? A reflex is nothing but it is an involuntary and nearly instantaneous movement in response to a stimulus. Basically, there are 5 primary deep tendon reflexes. They are biceps, triceps, brachioradialis, patellar, and ankle reflex. These deep tendon reflex testing evaluates the afferent nerves, synaptic connections within the spinal cord, the motor nerves, and the descending motor pathways. There are 2 types of reflexes. One is superficial reflexes and another one is deep reflexes. Superficial reflexes includes the plantar response, abdominal reflex, cremastic reflex, and corneal reflex. The deep tendon reflexes includes the biceps, brachioradialis, triceps, knee jerk, and ankle jerk. Let us just see this deep tendon reflexes in detail. So first one is the biceps reflex. So biceps reflex, it is a reflex testing that examines the functions of C5 and the C6 reflex arc. The test is performed by using a knee hammer to quickly depress the biceps brachii tendon as it passes through the cubital fossa. So the test actually activates the stress receptors inside the biceps brachii muscle, which communicates with the C5 spinal nerve to induce the reflex contraction of the biceps muscle. So this is so as a result, a strong contraction, which indicates a brisk reflex, that is hyperreflexia. And if it is going to be a diminished reflex, it would be either weak or absent. Brisk reflexes are used as a clue to the location of neurological diseases. A change in the biceps reflex indicates a pathology at the level of musculocutaneous nerve or the segment C5, C6 or some point above it in the spinal cord or the brain. So this is a picture depicting the biceps reflex. This is a place where we just tap it with a knee hammer at the level of the elbow. So which induces the contraction of the biceps. Triceps reflex, the next reflex. So this reflex assesses the spinal nerves, that is C6 and C7. So the procedure of doing is, suppose the patient's arm underneath the biceps to maintain the position in such a way as the midway between flexion and extension like this, and ask the patient to relax their arm and allow it to be fully supported by your hand like this. So identify the triceps tendon posteriorly, just at the level of, just above the insertion of the olecranon, and tap briskly with a knee hammer. You can notice the extension of the forearm. This is a picture depicting the triceps reflex. So you could see where it is being tapped with a knee hammer. The next is the brachioradialis reflex. So this brachioradialis reflex is used to assess the cervical spinal nerve C5 and C6. Ask the patient to support their arm on their thigh or on their lap, or on the therapist's hand. So try to identify the insertion of the brachioradialis, which is at the level of the styloid process on the radius, and gently tap it with a knee hammer, that is reflex hammer. The reflex consists of flexion and supination of the forearm. This is a picture depicting the brachioradialis reflex. Here you could see the tapping at the level of the insertion of brachioradialis, approximately 110 centimeter above the wrist. The next reflex is the patellar reflex. It is also called as knee jerk reflex. This patellar reflex, which is commonly known as knee jerk test, it is used to assess the lumbar spinal nerve L2, L3, and L4. Ask the patient to sit in a relaxed posture and ask the patient to relax the leg and allow it to swing freely at the level of knee. Tap the patella very gently and briskly so we could notice the extension of the lower leg. So this is a picture depicting the patellar reflex. You could see the knee hammer tapped at the level of the patella. So The next one is the ankle jerk reflex, the last reflex. This is also known as Achilles tendon reflex. So first give the basic instruction to the patient to sit on a high stool or on the tabletop so that the patient's thighs are supported by the top of the stool and the calf hanging very freely. The Achilles tendon is located just above the heel and connects the gastrocnemius muscle to the tarsal of the bone of the foot. So tap the tendons smartly and gently. So it produces a consistent contraction of the gastrocnemius muscle and a downward movement of the foot. Downward movement of the foot indicates plantar flexion. So this is the position, gently tapping it at the level of the Achilles tendon posteriorly. As you tap it, you could just witness the plantar flexion. So let us just see the grading of reflexes. How do we assess the scale? How do we grade the reflexes? 0 indicates no response or the reflexes will be entirely absent. And number 1, which will be trace very minimum or decreased response. Number 2 will be the normal response. Number 3 will be the exaggerated or brisk responses. And number 4 is indicated as sustained response, that is clonus. 0 will be absent reflex, 1 will be hyporeflexia, 2 will be normal response, 3 will be hyperreflexia, and 4 will be clonus. That's it with the deep tendon reflexes and the grading of reflexes. Thank you so much. Thanks for watching. Kindly support by subscribing and sharing. Meet you again in next video. Thank you once again.